Northern Health is proud to support and promote the practice of breastfeeding in our communities. Breastfeeding is a natural and healthy activity, and research is increasingly showing that it is an important factor in promoting good health, much like hand washing, healthy eating, and active living. In Prince George, a group of healthcare professionals and community members called the Prince George Baby Friendly Initiative has been passionately working to promote and support breastfeeding and quality breastfeeding services for mothers and their families. Jessica Madrid is a public health nurse who is leading the Baby Friendly Initiative.
The Baby Friendly Initiative is an international strategy to support and promote breastfeeding. It was created in 1991 by the World Health Organization and UNICEF. Communities all over the world are using this method to make sure that moms get the best breastfeeding care possible in healthcare facilities and in hospitals. In Prince George, thanks to Northern Health and the Children First Initiative, we have a dedicated committee of nurses, lactation consultants, nutritionists, midwives, doctors, mothers, prenatal educators. We're all working really hard to make sure that families get accurate information about breastfeeding and its benefits. We also work to make sure moms get quality hands-on help so they can comfortably and confidently breastfeed their babies. When healthcare facilities follow these best practice guidelines that we're working hard to promote, then they get to be awarded the baby-friendly status. So far, there are 10 healthcare facilities in Canada that have been awarded the baby-friendly designation. Here in BC, G.R. Baker Hospital in Quesnel was the very first hospital in all of Western Canada to get the designation. Shortly thereafter, BC Women's and Children's Hospital received their designation, and we're really hoping that here in Prince George we'll get to be the third.
So what do staff think about the Prince George Baby Friendly Initiative? Laura Ravlic is a public health nurse in Prince George.
As a public health nurse, I work with breastfeeding mothers all the time. We know the benefits for the growing child, such as reducing infectious diseases, diabetes, allergies, and obesity, but at the same time promoting optimal brain development. There are lots of benefits for moms as well. Some are reducing the chances of osteoporosis and breast and ovarian cancer. We also know that breastfeeding helps families save money, improve overall health and general well-being of our population, and protects the environment. The Baby Friendly Initiative is a great way to support the work we do because it makes sure that nurses have the right training and education to help mothers and their babies. I think we are lucky that there is an international strategy from the World Health Organization to help us offer the best care possible for our families.
Mothers from the Breastfeeding Support Group at the Northern Interior Health Unit also support the Prince George Baby Friendly Initiative.
I think that any program or initiative that can help mothers to breastfeed is so good for our community. When you're pregnant, all you ever hear about is how breastfeeding is so important and how formula is subpar compared to breast milk. I think that if breastfeeding is so important to our health, then I think that there needs to be a lot of help out there for mothers. We don't necessarily live in a community anymore where we see our mothers, our aunts, our sisters breastfeeding. And therefore, we need to have more programs, more initiatives available for breastfeeding mothers. And anything that promotes and helps mothers to breastfeed is so very important. With my first son, who's 2.5, he was born 3 months premature. I was able to come here weekly for support. I was having a lot of difficulties. Jean, the lactation consultant, was available. With this son, I've had different nurses being able to help. As I wasn't able to successfully breastfeed with my first son, I was able to get the support that I needed to successfully breastfeed this one.
In addition to promoting quality breastfeeding care in the hospital and community health facilities, the Prince George Baby Friendly Initiative is also involved in organizing World Breastfeeding Week. This Awareness Week highlights the benefits of breastfeeding and for many years has featured the annual Prince George Breastfeeding Challenge, a fun and friendly international competition that strives to set the record for the most mothers breastfeeding at one time. For Northern Health Highlights, I'm Erin Collins.